Hi, this is Dr. Bev Knox, and I am here today to talk a little bit about culture. Okay, you guys know that I'm going to post a couple of short essays on your quiz, right? Well, I've got the quiz right here, and I'm going to read to you this short essay question, and then I'm going to tell you how to answer it, okay? Or at least give you an idea of how you should answer it, because you do have total creative freedom. Authentic learning is what I'm trying to create in my classrooms, but you've got to follow somewhat of a similar pattern. So, define and explain culture. So you've got to define culture and tell, decide what is abnormal and abnormal behavior according to society, and tell its importance in psychology. Why do we care about culture in psychology? Okay, so you could jump online or you could look in your textbook and get the definition of culture. Okay, but some things I want to see in your definition would be like, belief system. Sure, belief system and traditions handed down from generation to generation. Sure. Something that's not a fad, because we know fads come and go, right? Like there's certain style of dress, and I always talk a lot about MC Hammer elephant pants. Remember those? Yeah? Well, that was a fad. It wasn't a traditional style of dress. I mean, I had one of those pants. It was the pants with the really, really big, bottom. Looks like a parachute, right? Back in the 80s and 90s, right? And I know that, it tried to make a comeback, right? It probably lasted for a month or so. Fashion goes and comes. Yeah, we know that, right? But that was a fad. It wasn't a traditional style of dress. So take a moment, because I'm going to ask you, give me an example of a traditional style of dress that would be considered part of, somebody's cultural fabric. Well, you could say, in India, women dress, in a certain way. Sure, that would be correct. In the Middle East, women sometimes, wear burqas, as part of their religious garment or what have you. Yes, that definitely is a cultural dress, okay? So, wearing a bikini, okay, we're here in the United States, and it's totally acceptable for, for women to wear, bathing suits and bikinis, and that's wonderful, right? It's totally okay to do here. Do you think you could do that in every part of the world? Well, do you? The answer is no. I mean, for sure, you can do whatever you want, but there's, consequences for certain behaviors, okay, in various parts of the world, all right? So you've defined culture, okay, and you must state, you have to grasp the concept that what may be viewed as normal in one culture may be viewed as totally abnormal in another culture, okay? So it's normal to walk around here in a bikini in the United States, but it may be viewed as abnormal some other part of the world, right? Like I remember going to Italy, and I talk about it because I absolutely loved my Italy vacation. And I used to be a beach bunny. I'm on every beach. Wherever I go, I'm on the beach. So it was customary for women on the beaches to be topless. And it wasn't a nude beach or anything like that. They were around their families. They're playing with their kids, and 90% of the women were topless. And then you saw the men, in these Speedos, okay? And I'm telling you, every man should not be in Speedos, okay? In Speedos, I mean like thong Speedos, and that was totally accepted in Italy. And that's fine. But here, in certain, beaches, I think families would be very upset if most of the women were topless and their kids were looking at that. So again, what may be viewed as normal in one culture may be viewed as abnormal in another culture. In this short essay, you have got to give me an example. Okay, I just gave you a few examples right now. You have got to give me an example that I didn't give you. Find your own example, okay? And then you have got to tie it into psychology. Why do we care as psychologists, a human service worker, why do we care about culture? Well, it's very relevant in psychology to prevent misdiagnosis. Okay, so you the therapist, the social worker, clinical social worker, you have got to understand your patient's background, cultural background, before you call yourself diagnosing them. Why? To prevent misdiagnosis. That's it. to prevent misdiagnosis. You don't want to misconstrue. You don't want to assume something about somebody not knowing how they grew up, what their cultural background is, okay? So it's majorly important in psychology for us to understand somebody's cultural background, okay? Alrighty, I'll talk to you soon.